So what does that look like at medical teams? A great example is Sudan, although I don't think Sudan is alone in this. This is a pretty typical way that we operate in all of our country programs. But just to pull out an example, we are in Sudan, we're partnering with UNHCR and other NGOs like ZOA to cover all the areas of need, including protection and WASH, in addition to those direct health services and the community health components that we directly manage. We're also actively participating in the regional refugee coordination mechanisms, camp coordination mechanisms, and the health cluster. Most recently, we participated in a large nutrition assessment exercise with UNHCR and other partners called a SEND survey, which allows us to look at nutrition and like infant and young child feeding practices, et cetera, across the population to assess what those risks and issues are. So this helps ensure that we have complementarity of our activities and that information is shared effectively across all the actors in the response. It also helps us like both identify gaps and prevent duplication of efforts. Which means that we're using the resources as efficiently as possible and providing for the largest number of people possible with the funds that we have. A second great example is in Uganda. So as one of our very large program with many health facilities across the country, very integrated with the Ministry of Health. We are coordinating with the district health offices, with UNHCR and other humanitarian actors to respond to those acute influxes of refugees, which we've talked quite a bit about recently, and also when there are new outbreaks. We engage as a core member of the COVID-19 community engagement strategy, which activated these village task forces in the refugee settlements to help manage home-based care as cases of COVID-19 rose in the settlements. We also partner with Tutupona and Humanity and Inclusion to provide more complementary and holistic services around mental health and rehabilitation. So this allows us to address emergencies with limited resources by coordinating effectively with all those other stakeholders and working with other organizations who have different areas of expertise to provide that holistic response.